Every day, millions enter hospitals, seeking healing. They trust the hands that promise life, but what if those hands are hiding secrets that can kill? Behind the pristine walls and bright lights, a dark world thrives. A world of greed, deception, and betrayal, where one wrong decision can mean the difference between life and death. Tonight, we reveal the hidden truths inside hospitals: corruption that drains your wealth, malpractice that risks your life, and crimes that remain concealed behind white coats. Hospitals are meant to be sanctuaries of hope, where science, skill, and compassion converge. But for some, these walls are not protection, they are playgrounds for exploitation. From inflated bills to unnecessary procedures, from forged records to secret experiments, corruption inside hospitals is not just unethical, it's deadly. This is the story of the shadows that lurk where healing is meant to happen. And once you see it, you can never look at a hospital the same way again. Imagine visiting a hospital for a simple checkup. You leave thinking it was routine, only to discover later that your bill is 3 times higher than it should be. Unnecessary tests, ghost patients, inflated drug costs, every line on the bill a trap. For some, it's just extra money. For others, it's a lifetime of savings gone in a single visit. Example: in one city hospital, routine blood tests were billed multiple times, surgeries were added without consent, and insurance claims were falsified. Patients trusted the system, but the system was built to exploit. Behind every fraudulent bill is a person who believed they were safe. Behind every deceitful calculation, there is someone gambling with a life. But corruption isn't just about money. Sometimes, it's about control, and sometimes, it's about life itself. Unnecessary surgeries, risky procedures done without consent, mistakes hidden in reports, lives endangered, all while administrators cover their tracks. Hidden crimes include unauthorized surgeries, patients undergoing procedures they didn't consent to, manipulated test results, false reports used to justify unnecessary treatments, illegal experimentation, clinical trials conducted without patient knowledge. One nurse described how a patient's heart monitor alarms were ignored until it was too late, all to save costs, or perhaps, to cover human error. By the time help arrived, the patient was gone. The most chilling evidence comes not from paperwork or statistics, but from the stories of those who survived, or those who didn't. A young mother went in for a routine delivery. She trusted the hospital staff. After complications arose, emergency care was delayed, allegedly due to shift mismanagement. The result? A tragedy that could have been avoided. An elderly man with chronic illness received a diagnosis that demanded an expensive surgery. Tests were falsified, his insurance exploited. Months later, the truth emerged: the surgery was unnecessary, yet his family had paid tens of thousands. Every testimony paints a portrait of fear, distrust, and betrayal. Hospitals, the supposed sanctuaries of life, become places of suspicion and terror. Why do these crimes continue? Why does corruption flourish in a place meant for healing? Hospitals are complex systems. Layers of bureaucracy, lack of oversight, and weak regulation create fertile ground for corruption. Key failures: poor monitoring of finances, lax regulatory enforcement, fear of whistleblowers, influence of pharmaceutical and insurance companies. Even when complaints reach the authorities, investigations are slow or incomplete. Administrators often protect their own. Whistleblowers face threats or dismissal. And patients? They are left vulnerable, powerless, and sometimes dead. It's a system designed to protect the institution, not the individual. The damage is not only financial or physical, it is emotional, psychological, and social. Families lose trust in doctors, patients fear treatment, communities question healthcare systems, and the psychological trauma of those who survive is profound, leaving scars that last a lifetime. Some never step into a hospital again. Others live in constant fear, questioning whether the very place designed to save them could also destroy them. And in the darkest corners, some staff themselves are victims, trapped in a system that rewards compliance over conscience. Hospitals should be safe. Hospitals should heal. But the shadows exist. Greed, corruption, malpractice, and hidden crimes, all quietly thriving behind white coats. This is not just a story. It is a warning. Awareness is the first step. Demand transparency, demand accountability, and never accept blind trust in those who hold your life in their hands. Because in the end, one wrong decision in a hospital is not just a mistake. It can be a death sentence.